Hello and welcome to Workforce Wisdom. I'm your host, Christy Bray, Chief Strategy Officer at PracticeLink. This podcast focuses on the latest trends in healthcare recruitment while showcasing innovative strategies, success stories, and fresh perspectives affecting the healthcare workforce. These episodes will lead to in-depth, thoughtful discussions with recognized industry-leading healthcare professionals exploring the challenges of healthcare recruitment and beyond. Whether you're an experienced recruitment professional or just starting out, this podcast aims to help you discover how experts are reshaping the industry, leveraging technology, and fostering inclusive hiring practices. Today's episode, Recruitment Excellence in Healthcare with Hope Valvero. Welcome, Hope.
Thanks, Christy. Glad to be here.
Glad to have you. For our listeners, Hope is the Director of Medical Staff Development at CHS, where she's been leading efforts since March 2024. With over 20 years' experience in healthcare recruiting, she has honed her expertise by working with renowned healthcare organizations, including SSM Health in St. Louis and ChenMed, where she led a successful sourcing team for 2 years. Throughout her career, Hope has cultivated a deep understanding of the healthcare recruitment landscape and has been instrumental in shaping recruitment strategies that attract top-tier talent. Her leadership in physician staffing has had a lasting impact, helping to meet the growing demand for healthcare professionals across diverse settings. Having grown up in rural Southwest Missouri, Hope is especially passionate about improving healthcare access in rural and underserved areas. She is committed to ensuring that communities in need are provided with the healthcare professionals and resources they deserve. Outside of her professional life, Hope resides in St. Charles, Missouri, just outside of St. Louis, with her husband Jason and their 15-year-old daughter Claire, along with 2 standard poodles and a Maltese. She is passionate about balancing a fulfilling career with a vibrant family life and enjoys spending time with loved ones and her furry companions. I'm glad to have you here today, Hope. We do have a lot of the same background and experiences and share that passion for rural and underserved areas for sure. Let's start a little bit, talking about you and your career path. As we heard in your intro, lots of experience over the years, but how did you get into recruitment? And then walk us through your career journey and kind of what led you to the work you're doing today.
No, absolutely. It's funny how things end up and kind of how things transition. I always felt like I wanted to do some sort of work in recruitment, but never in my wildest dreams did I think I would be in physician recruitment. And somewhere along the way, ended up in healthcare and kind of cut my teeth in nurse recruitment and different ancillary recruitment roles within the hospital system, and really didn't even know that much about physician recruitment. It wasn't something that was typically on the radar. They don't offer a degree in physician recruitment, as you know, and found out about the position at SSM Health and just took a chance and was fortunate enough to have a leader that just felt like he would take a chance on me. And so I just learned so much within the time that I was there, and that career just evolved. And so I spent the bulk of my time with SSM Health, left there and then came back and was recruited away to a private company called ChenMed, where I spent about 2 years. Loved that opportunity and learned so much just about sourcing and about value-based care. Really enjoyed the model there and the team that I had there, but unfortunately, my position was eliminated at ChenMed. So really found myself kind of at this pivotal point and really was thinking, do I want to be in physician recruitment? Is this where I want to spend the rest of my time? And during that time of soul searching, I just came to the realization that, yes, I really love recruitment and I love physician recruitment. And so by networking and just talking to different people, Christy, one of them being yourself, I discovered the role at CHS and have been there about a year and have had the great opportunity to get to know that organization, and we're doing some very exciting things there.
Your team is a national team. Give me a component of in-office, fully remote, and those folks who you support right now.
We are all fully remote, the entire team. So there are 14 of us who do the sourcing component, and we have a very interesting model at CHS. So we have some recruiters who are actually sitting in the market. We have folks who report to corporate but sit in the market. We have folks that don't sit in the market and report to corporate. So there's a lot of different components there. But I believe it was about 3 years ago, they all went completely remote. So the office is in Franklin, Tennessee. My leader, I think there's one other leader who comes into the office 1 day a week. Everyone else is completely remote. And we've been able to make that work. I do really value the opportunity that we get to all come together one time a year and just connect and get to see each other live and visit and interact. But we've made the remote piece work. And it seems to work well. And I like the flexibility that it gives everyone, especially when you're doing sourcing and physician recruitment. It's not a 9-to-5 job.
No, it's not. Yeah. Thanks for that background. Being right up the road for me in Franklin, Tennessee, I've had the pleasure to meet some of your team. What would you say, as you've joined about a year ago, what were some key pieces to building the culture and that team? I'm assuming you probably hired some folks, but a lot of those people you inherited when you got there. But that can be really hard. Some of that's hard stuff as a leader, and then retaining folks and growing them further.
It was hard. I'm just going to be transparent about that. It was really challenging and kind of a heavy lift as we first started. So they had been without a direct leader for, I think, over a year. And many of you know, when you're reporting up to a couple of layers up on the ladder, that person's available to you, and they absolutely did know that about the vice president, but they shied away a little bit from reaching out because they just didn't want to bother her, or they wanted to make sure it was a very important topic before they took her time. And so they were very used to working on their own. And I appreciated that very much. But by doing that, sometimes they aren't learning as much, or they aren't reaching out for help, maybe where they should. So I spent a lot of time just talking to each one of them one-on-one and just building trust. Listening, understanding what challenges they had, what thoughts they had. At one point, I had what was all females on my team at the time. And so I gave them an assignment and said, I want you all to pretend that you are queen for a day. And you are queen of CHS, physician recruitment, sourcing, you can, whatever you want. And I want you to completely tell me on a piece of paper how you would run the department. The only rule is you can't fire anybody and get rid of anybody. You can realign. I still get to keep my job, but you can make yourself any title that you want. You can shift people around, but bring out the ideas. And it was really interesting, the things that they sent back. Some of them were a little bit more hesitant than others. Some of them really got into it. Like a couple of them even wrote, "This is Queen Sylvia's decree," right? And so they really enjoyed being able to share that. And I learned so much about the department. I realized I already knew that they saw gaps and they saw what was working and what wasn't, but I was able to really determine how much of it they saw. And the key to success is talking to the people who actually do the work and understanding what gaps there are, where they see the needs, what can be improved. And by doing that, we were able to really improve almost some of the low-hanging fruit, some of the easier things, like, hey, it would just be really great if we could just do this. Great, we can make that switch, that's no problem. And then the rest went on the timeline or the parking lot for future changes. But I enjoyed doing that with them, and I think then they also saw that I really wanted their feedback, and they felt like they really had a stake in the game.
Yeah, you definitely created that buy-in with them. I think that's a great exercise for anybody coming in, new leaders in their role, is ask those folks and listen. There will be things that you've been given as a leader to do that may not work within, some of those suggestions that you're given, but that's a great exercise that you did, I'm sure. Knowing some of them, I'm sure it was really fun, like a fun project for them to put on their crown and go to work. So one of the things you mentioned is that you are all fully, work from home. I like to say work from anywhere because sometimes I am in my car at baseball practice or something, taking a call. And you're right, recruitment is not 9 to 5. It's not 40 hours a week. These are expansive jobs based wherever the physicians are. That's what time you make yourself available. But what other significant changes have you seen, kind of that old, we all went into the hospital or into a clinic office, to being mostly working from home? But what else have you seen in terms of changes within the recruitment industry and maybe how that has changed your approach?
One of the interesting things I think about physician recruitment is the way we recruit physicians and it really hasn't truly changed. We're all still looking for the easy button that we can just push, right, and make it happen. And there's no quick fix. We've just really seen it become more difficult and more challenging because of the shortages. And if there has been the easy button found, no one shared it with me yet, but I'm hopeful. There are so many advancements in technology and sourcing methods, outreach strategies, increased competition. All of those things are what has changed the most. But what remains constant, I truly feel, is that relationship that you build with the physician as a recruiter and really understanding what the physician is looking for or what your organization is looking for and matchmaking. And that is the key to me of success, is that personal interaction. And then you apply all of those other things that have changed with technology and AI and just different things that we're able to use as far as outreach goes to help just move our process along. But what hasn't changed is that one-on-one interaction that we need with the physicians.
I would agree. I think a lot of people ask, like, how do you think AI and some of these rapid tech improvements, will they replace recruiters? And I always say no, because it really is different when you're finding people to serve in these communities. And I just don't think you could teach AI or have a robot do those things. I think ultimately still have to have people hosting their site visits or a dinner or something, like it is so competitive that you have to roll out that red carpet all along their recruitment process when you're trying to get somebody to commit, most likely to relocate and join you in one of the locations.
Exactly. And I think one of the key things that we see now too is what the physicians want in their career. When I first started doing this many, many years ago, the physician questions would be, how many patients can I see? How much money am I going to make? What are the hours? Just the workforce was different and the expectation was different of the workforce. Now, what the physicians want out of their job is almost opposite in some ways. They want work-life balance. They do still want to know what their hours are, but they want to understand if they can still have time for their family. They want to be paid a fair salary, but they also want time off, and that's important to them. We used to be able to say, oh, you can have as much time off as you want. It's an RVU model. And we never worried, right? Because you had to threaten the physician to take time off. And you can't say that anymore because this generation of physicians really value their time off in a different way. But they also want to know how they can provide quality patient care, but still be able to have a fulfilling life outside work.
Yeah, and I think that also seeing they want to be aligned with your culture or your mission, probably more accurately your mission. What is the organization doing, especially something like CHS that is national, within that community that you're serving of Las Cruces, New Mexico, or Fort Wayne, Indiana? They want to know that that meets their personal values and mission for life. Can you share with us like some recent examples of some innovative strategies? So you've been there a year, maybe something even at ChinMed. I think that was fairly new, what you were getting done then. But things that you have implemented or either seen and learned from other folks in the healthcare recruitment industry.
It's not probably so much innovative. It's kind of one of those things where I think, wow, why didn't I think of this before? But one of the keys I have found to successful recruitment and sourcing is to intentionally block time on your calendar and set it aside and say, this is my sourcing time. It's uninterrupted. I value that time. You've heard people say, if you want to lose weight or start an exercise program or whatever, you have to be dedicated and it has to be uninterrupted exercise time, right? Well, it's kind of the same way with sourcing. And it wasn't until a few years ago that I realized that even if in our busy schedules, we only have an hour, but what can I do in that hour? And how do I just keep that hour sacred, right? Because I have to do that in order to meet the goals and demands of filling my pipeline. So I try to encourage my team to work in sprints, set aside that time. Now they're doing sourcing all day long, but setting aside an hour, 2 hours where they're intentionally reaching out to 5, 10, 15 candidates during that hour on a personal level, whether they're picking up the phone, whether they're texting, so it's other than email blasts or massive outreach. Those are all important and they all play a role in recruitment and sourcing, but actually doing deliberate sourcing, reaching out to those candidates individually, and then continuously doing that throughout the week and filling that pipeline. It's that personal touch, and then you continue to engage with those physicians. Even if you do 5 outreaches a day, by the end of the week, you will have reached out to 25 physicians individually, and your connections then become invaluable, and the opportunity for success is bigger when you approach it that way. So it's not necessarily an innovative idea. I just wish I'd have thought of it years ago. Can you imagine? I probably would have found the easy button by now had I done it.
Yeah, and I think that making sure your team has the tools to do those pieces beyond the email. So you mentioned text. I don't know if they're using their personal phones or not. Some people get a little, weird about that. That finding that sweet spot that works for them, and it definitely creates a different candidate experience with that engagement with your team.
It does, absolutely. I used to spend, though, hours trying to craft an email or a text message because I'm not a writer, and I speak the way that I write the way that I speak, and it's not always the best approach. So I guess the biggest thing that's changed my life is ChatGPT, because what used to take me an hour to create something, and then I would reread it and think, that still sounds ridiculous. What am I even saying? I plug it into ChatGPT, it makes me sound brilliant and professional, and it writes it for me, it's polished, and then I just drop it into the emails, and it's very quick, and it has completely changed just the approach to everything and how much time I have to spend doing it as well.
Yeah, I use a combination a lot of ChatGPT and Grammarly. I like the way Grammarly sounds less robotic sometimes. So I have both. And the Grammarly lays right on top of whatever you're working in, Word, PowerPoint, email. And so you're able to do that same as you're posting jobs on job boards. If you have Grammarly plugged in, it'll give you suggestions as you're making your post on something like PracticeLink. It'll give you suggestions of words, or I never understood why people didn't always have like spell check turned on. Very, very easy thing where you catch those errors. So you kind of went into some of the emerging technologies I was going to ask you about. Anything else AI related, different than chat or having it write for you? Maybe writing emails, writing job postings that score higher SEO value, but any other data analytics or things like that that your team is using?
Really learning to take those analytics that we're able to acquire. So one of the things that the pandemic did for us is just enhance technology so much and gave us all of these new tools and tricks and things to do. So we can really track almost anything, right? I remember when it was just exciting to know that you could do a heat map and figure out where someone's mouse was hovering. And now it's beyond belief what type of analytics we have. So I think the key really is to take those analytics that are available to us and analyze them and look at what do the numbers tell us and how do we then almost work backwards from that. So if we have reached out to 25 candidates or 30 candidates and we still cannot get a candidate to answer our email or respond to us, then we need to look at it from a different point of view. What is the job missing? What is going on here? Is it that the location is more difficult? Maybe the salary is not the right thing. Maybe there's just a shortage. Maybe it's a combination of all those things. But we're trying to really look at all of those data analytics and say, okay, what does it tell us? And now what can we fix, if anything? Because we can't pick up the hospital and move it to someplace else, right? I mean, if we could, probably would change a lot of the things that are happening right now, but we can't. So that's a given, but can we change these other pieces? And what do those numbers tell us? How do they guide us to make the changes in future outreach or the way we recruit or even what the position looks like?
When you're doing that, are you doing it by specialty or more by market and the location? I know in the past, I have had different compensation models for a rural versus urban setting. So the rural was always higher. Their sign-on was higher. Their student loan incentive was higher. Their base comp was higher. We needed them there. So you're kind of taking a hit on, they get a higher salary and the work RVU, but is that how you do that? Because it sounds daunting, knowing you have 400 or 500 positions open every day. How do you do that? Or is it something organically that comes up over time because you've identified, okay, difficulty, it's been open 180 days, or it's brand new, this is going to be hard? When within the cycle do you kind of work through some of that?
Yeah, that's a great question, Christy. And we're kind of evolving right now as we do that. We're in the process at CHS of moving our sourcing team from sourcing for markets to sourcing by specialty. And so we've really had to take a look at that because we are large, and how does that really work? Not every position is going to be the same depending on where it is, the specialty, all of those things. So I had each one of the sourcers start first by going through their markets and giving it a score of 1 to 5, with, maybe 5 being the most difficult place. Palmer, Alaska, while beautiful, is not everybody's place of choice to relocate to. It's going to be a little bit more challenging. If you have to find a urologist for Palmer, Alaska, it's going to be beyond difficult. So we've started out, and we're just now in the infancy stages of doing that, but giving these jobs and locations a score so we can understand what we're up against, and then taking that information and then looking at the timeline and, okay, it's 30, 60, 90 days. Where do we think we should be? Setting those goals for ourselves and really looking at the candidate pipeline based on that. I look at it a couple of different ways personally, and that vision and idea may change based on what we learn as a team. If we've gone 30, 60 days with no candidates, that's fairly unusual for us, just based on our size and the resources that we have. Or if the other side of the coin is sent over 5, 10 candidates in some cases, and we've not been able to close a deal, that tells a different story. So that's where we're starting is, okay, if there's nobody, why is there nobody? What work are we missing? What is going on here? Or the flip side of that coin, if we've sent over several. So we're still trying to kind of iron that piece out. And it is a little daunting, but I think we'll learn as we go. And I'm hopeful that by aligning everyone by specialty, they will really have a good idea of what areas have gaps. They'll be selling all of CHS to candidates. So if they're talking to a GI, they're going to talk about all of our opportunities, which most recruiters do anyway, right? Because they're not working on the scale that we're working on at CHS. And also that feedback we'll get from candidates is going to be very telling. Oh, well, how about this opportunity in Poplar Bluff, Missouri? Oh, no, I would never live in Missouri, or I would never do that, right? And if we start to hear those things over and over, working with the sourcers on recognizing those pieces so that they're kind of filing that away, and that's things that we can start to work to address.
Yeah, I like that you mentioned looking at the pipeline. My teams would always look to see how many jobs of that same specialty were posted nationally in that state. And then conversely, right, how many people with ties to that state or that area, if you need it, Northern California versus Southern California, to really paint a good picture, especially to your leaders when they expect you to have a candidate yesterday. And urology in Alaska is probably one of the more difficult. You could have said ENT in Alaska. It's just really, really hard, where that's probably going to be a 400-day fill, or like, can you get a locum? I mean, that is a tough thing for those operational people to kind of think about, but probably not having somebody start this year.
Right, absolutely. And right. I'm actually glad you brought that up, is that's one of the things that we're trying to invent right now, is trying to do that, create that funnel. So we're using several different tools, including PracticeLink, to go out and say, okay, here's how many practicing physicians in the United States. Here's how many are within maybe this age range. Not that we're going to discriminate, but we do know that people over a certain age are less likely to relocate, for example. And then how many folks are coming out of training. We look at what does MGMA say for salary and where do we rank in that. And then we are actually going into our different tools like PracticeLink and doing a search and saying, okay, how many physicians are listed in PracticeLink for this area or surrounding states? And ultimately trying to come up with a number so that we can show our leaders and our hiring folks within the market, we're looking at a pool of about 5, right? Or we're looking at a pool of 200. And so then trying to encourage them to understand and react accordingly when it comes to, we give you a candidate, we're going to need to get in touch with them really, really quickly. We don't have a lot of time to waste. Or you're not going to see 5 candidates before you can make a decision. You're going to have to base it one by one. And that really helps drive the sense of urgency, I think, within the market, or that's what we're hoping it's going to do.
Yeah, I'm sure somebody smarter than me could figure out some type of algorithm with that. So much like your locations, which is probably based on school system or cost of living, or if it is rural, that 1 through 5 you said, I bet somebody could get to some type of formula that would really show your leaders, like, this has a 60% chance to fill? I don't know how you get to that, but I think that would be really interesting for somebody to figure that out. Some of it is probably a livability score. The comp is still there. Comp isn't what they ask about first anymore, but it is still important. And probably more importantly is that whole package, like you said. What's all in on their comp? What's their workday look like? When can they have family time?
Did you know PracticeLink is not only home of the most widely used online physician job board, but we also have our own magazine? PracticeLink magazine has not only won several awards, including 2 ASBE Awards of Excellence in 2023, but it's also completely free. Over 375,000 physicians and residents receive copies of PracticeLink magazine each year, and you can too by visiting practicelink.com/magazine. That's practicelink.com/magazine. Thank you for listening. Now we'll return to the podcast.
So I think you mentioned your team recruits for both physicians and advanced practice providers. So anything unique, we mentioned shortage several times, but other strategies for really addressing the shortage in both. I know you see it in CRNA market and some specialty PAs, but how do you go about like kind of developing some strategies there when you know there is that severe deficit of folks graduating from school?
No, I think it's an ongoing challenge all the time, right, with developing our strategy. And it does go back to letting the numbers guide us and what are we seeing in those markets. That funnel, I think, is going to be really important to us as we do that, whether it be just the timing of how quickly we contact the candidates, how quickly we get an offer out there. And then as well, really working with our hiring leaders to help them understand candidates are looking for a lot of different things now. They're looking for flexible schedules. We have the opportunity to integrate advanced practice providers into the workforce. What is the telemedicine usage? We can increase the use of AI, not only within our recruiting efforts, but then also within healthcare. But the biggest is going to be retention. Once we get them, we need to figure out how to keep them because it's not an endless pipeline anymore. I don't even really remember when it was, but it's definitely not getting any easier.
Does retention roll up into like your team or your leader's team, or where does that live within CHS?
It doesn't roll up underneath our team. I think it's important for recruiters to understand that we want to help with retention by setting ourselves up early. And the way that we impact that is really trying to understand what type of physician are we looking for beyond what the specialty is or what procedures they do, but how do they fit within the practice? Is it a group of younger physicians who maybe spend time together and it's not unheard of to go to a ball game together or to have families get together? Or is it physicians who are maybe less social? What does that practice look like and how does that partner fit in to that scope? And so it's been challenging to really get our partners and our hiring leaders to just really open up and say, this is what I'm looking for. And if we could really understand that, it would just help the matchmaking be so much easier. And then on the flip side of that, helping obviously our hospitals understand what we see in the market as far as how many providers are available. I'm preaching to the choir when I say if we would just take a look at how much it's costing to have a vacancy, how much it's costing to replace the physician, what it's costing to have patients who don't have a physician to go to, that dollar amount, retention practices would be so much cheaper compared to that dollar amount.
Yes, incremental to the replacement. And I think that it's a lot of those pieces within retention are soft. It's hard to standardize or do some of those things because, like you said, every practice is different. Every specialist is kind of different. And then every just person is different. So in that way, knowing you serve a lot of different communities, is there specific work that your team is doing to really promote diversity, equity, and inclusion within the recruitment practices? And maybe even a step further, how are you taking some of those initiatives to really have those practices and those clinicians be a representation of the community that they're serving?
One of the key things is going back to that practice profile, right? Understanding what type of practice it is, what community they serve, and then trying to match those individuals up because it is matchmaking. And then one of the ways that we try to do that is looking at where do we target to find the right candidate for that position. So looking at historically Black colleges and universities, or maybe medical schools or universities that draw candidates from underserved areas that are coming from those areas that they truly want to give back to so they can really relate. We want to work with people that are like us. We want to see physicians that are like us and that understand the unique things about us. And so that's really been key at where we look to find the physicians. And I think that's one of the things that technology has helped us with. We can go out and look up ChatGPT or Grammarly or whoever, give me a list of all of the historically Black colleges and universities. Tell me about all the organizations that are dedicated to this type of physician, or what does that look like? And then the other key piece is just learning so much about your community. We all kind of live in our own bubble, myself included. I'm just as guilty. I was shocked to figure out in St. Louis that there are 2 newspapers that are written specifically all in Chinese. I didn't know that. I don't speak Chinese, so I never had the need to pick up a Chinese newspaper, but I didn't know that it existed. And it wasn't until I was interviewing candidates that Chinese was their first language that came up in a conversation with someone else. And so it was just something else that I could understand about the community and that we could offer and let them know that that type of diversity is there and how they can feel comfortable in the community and what they can provide. Because obviously, if we have a Chinese newspaper, we certainly have people in the community who speak that language. And so there's going to be a need for a physician. And so just kind of drawing those back together and connecting those dots.
Yeah, I would say throughout my career, the most fulfilling providers that I've helped with have been those that fill that need, especially that language barrier need, because people, they just don't access care if they're not comfortable. And in this case, it was Spanish, not Chinese. Chinese seems a lot harder, but it was amazing to see what this physician was able to do in such a short period of time that people were not coming to see the doctor because of that. And I think, like you said, it doesn't take a lot to realize what other segments are there in the community. And you might find that you attract different candidates than even you thought you could, because you're able to speak to that and say, oh yeah, we do have that. There is a large need. And they get really comfortable about it, because I think those providers intrinsically are drawn to those type of opportunities. They want to serve their people as well. So yeah. My other place I always loved was rural training tracks, like finding those family medicine rural training track kids. I was in Colorado for a long time, and we recruited into Wyoming. So the WWAMI program, if people are in Washington, Wyoming, Alaska, Montana, or Idaho, those kids, just amazing. First, you got to kind of be wilderness to live in some of those spots, but they gravitate to that. They're going to go home. They're going to stay there. But those WWAMI kids, I really, really enjoyed talking to them about opportunities when I recruited in the West.
And it makes it so fulfilling. I think in our jobs, we know that we're making a difference in healthcare by matching up the right physicians, but to really know that we're putting a physician back into a market or to an area that they came from to really make a difference, it just adds a level of fulfillment for us as recruiters. It's just something more tangible that we can see.
And I think that it's not that other people wouldn't work as hard for them, just the comfort level. You get rid of some of those layers that make it uncomfortable for folks who may not speak our language or look like us to go into those settings. So let's talk a little bit about the future. I know that we attend a lot of the same leadership conferences and a lot of the educational opportunities provided by APPR and other organizations, but what really is exciting to you about the future of provider recruitment? We're starting to see some of our peers retire, which is happy for them, scary for us, I think, because we got some years to still work. But what should people be preparing for in 2025 and beyond?
At one point, I had heard someone say, this was many years ago, I had interviewed for a job that was closer to my family, and the person interviewing me said, our recruiters are really on autopilot. They're fine. And it really resonated with me, because I feel like if a recruiter is ever on autopilot, then they're missing out. They're not doing what they should be doing, and how boring. I don't ever want to be on autopilot. That's not where I want to be. So one of the things that has always been exciting to me in healthcare recruitment, physician recruitment, is the fact that it is always changing, right? There's always new things. The healthcare industry is changing, new practices, new laws, new ways that we do things. And so it's always going to be a challenge. So for the future, I think it's just continue to learn. But also, you mentioned AAPPR and a lot of those different areas that we have opportunities to attend and to learn from. I've learned a lot by going to those different professional organizations and those conferences, and it's invaluable. But what I really value and hold true to my heart is just the relationships that I've made with people who, some of those that have retired, that have mentored me along the way. When I first started doing this, I just didn't know, I didn't know the difference between a family medicine doctor and an internal medicine doctor. And so I needed a safe space to find that out, because I certainly wasn't going to ask my boss. But those mentors, those connections, those people that are safe spaces that you can ask, because physician recruitment is a tight community. And so as that continues to evolve and we see younger generations coming into it, they're teaching us things, they're showing us things. That is and always has been exciting to me, because there's still just so much to learn and different things to try. It doesn't take the place of the personal relationships, but there's just always new, innovative things. We're going to go to APPR in a couple of weeks, and there'll be all kinds of things that people will be rolling out, and new technology and things they'll be excited about that will make our lives so much easier. So that piece is just exciting, I think.
I think your advice you gave really on that networking and those relationships, anything else I think that you might be able to share? How do you help your team not get burned out and kind of encouraged every day where they do have some of those hard locations? Are there things that other leaders could do, or even lessons as an employee who you got to that point? You said that earlier. I don't know if I want to keep doing this, because we need people to keep doing this. So any other specific advice about that kind of burnout or that stress component?
I've always felt like in physician recruitment, you're kind of on an island to a certain degree, right? You're only as good as your last hire sometimes. And some people, when I say that, they're like, oh, that's horrible. But to a hospital administrator, they may celebrate with you for just a minute, but then they're like, okay, but what about this, right? Or where's the next one? I have more. I need more. And that's their job. So I just feel strongly about, you have to celebrate within your own team, and really celebrating those successes, making it a big deal with each other. We have just a group chat that is ongoing. And if someone talks to a great candidate that they're really excited about, or something funny happens when a discussion, or maybe they oh my gosh, they interviewed this person, they called them, or we signed them, and we all do the emojis and all these things, coming up and letting everyone know that we're celebrating it. I found a tool not too long ago called a Kudo board. It's a technology piece, but it's, a couple $100 for the year. And it's a graffiti board that you can create. And so just purchased it here for us. We just started using it. I think we're on our third or fourth time, but celebrating those milestones for each other, like birthdays, or it's your career anniversaries or just significant things. And so you can send out the link and everyone can write, upload GIFs and emojis and, different things on it and write little messages. And then you can set it up to deliver to the person. So those are just the things that you can do within your group, because you do truly have to be the ones that pump yourselves up. And then on the flip side is letting each other have moments if someone just needs to vent, because we can get frustrated and we can't show that frustration to the candidate, or we can't show that frustration to the hospital president or the CEO. Not that any of them ever upset us. They're all perfect. But if we do, it's nice to have that safe space with each other to just kind of share that and unload it and just decompress a little bit.
Yeah, I think it's important, both the celebration and the venting, to have that safe space. I like that. I wrote down Kudo board for sure. I think that it's fun for me. I still have people that were on my teams from years ago, and they will text me when they sign someone. Now, I have no affiliation with this organization. I don't live in that town, but I love it. They're like, it's a husband, wife, and a this and a this, or some of them have been physicians that we helped get them over the line, and they started, and now they're doing a new procedure. They've seen this many patients in the community. And so that continual update for me, and that serves as a reminder, it is very important what we're doing, indirectly saving lives and bringing these folks to these communities. So that's a great message. Thank you so much, Hope, for your time. I appreciate you joining me today. On behalf of myself and PracticeLink, wanted to just thank you for appearing. For our listeners, please feel free to reach out with any thoughts, insights, or questions about anything we covered today, or email plmedia@practicelink.com. I'm sure Hope and myself would love to connect with you on LinkedIn if we aren't already connected. I know through the years we have mentored each other and counseled each other through a lot of life changes, probably from 15 years, maybe? It's been a while.
Which is amazing since we're both only 30.
I know. Yeah. So this has been a great friendship and partnership, and I do appreciate having you today. So thanks again, everyone. My name is Christy Bray, and join us next time on Workforce Wisdom.